first got into acupuncture in 1997. I was living in LA and I was interested in doing healing work as a profession. So I started to research different methods. And through my research, I found that acupuncture was the most effective one, and you could get a master's degree and have a good career. And I live right next door to an acupuncture school, so I went there and talked with the dean of the school, and that helped me decide to do it. And once I decided, I went to school in New York and got a master's degree there. And our master's degree program was a 4-year program. And I also studied briefly in China and Tibet on a few occasions. I was always interested in Eastern philosophy, so through pursuing that and studying martial arts, I decided that I wanted to do some kind of work where I help people out every day in a direct way. So I started to look into different healing methods, and I felt that acupuncture and Chinese medicine was the most ancient method that you could still get a master's degree in, study with a traditional master, and have a great career in. I went to school in New York at Pacific College of Oriental Medicine, which is in Manhattan. It's one of the best schools in the country for acupuncture. And in China, I studied in Beijing, Chengdu, Datong, Wutai Mountain, and Ermei Mountain with Master Chen Longzhong, who is a Taoist patriarch of the Longmen Dao from the 24th generation of Lao Tzu. And I also studied briefly in Tibet. Everything is new knowledge. You don't know any of the information at first. So the first 2 years is basically just memorization and repetition of the information. So after that, once you start to know the information, then you can expand and start to study the different theories and application of the different practices. We also studied massage therapy within our system, and it was called Tuina, which is a Chinese medical massage. Curriculum at first was you learn the basics of Chinese medicine, acupuncture, herbology, and Chinese medical theory. And that usually takes about 2 years to learn the basics. And then after you learn the basics, then you go into in-depth theory, diagnosis, and analysis. All right, these are the packages that the needles come in. As you can see, they're pre-sealed. And there's different kind of packages. This is a multi-pack. It's 10 needles in one pack. Sometimes the needles are separately packaged, so it'll be 10 separate packages for each needle. So they're already sealed, pre-sterilized, sealed here. You just open it up. This one contains one tube. Sometimes there's a tube for each needle. This one is less trash, so I use these. You put the needle in this tube, and then you place it over the skin, tap it in. After it taps in, you grab the handle here and push it in. There's different ways of doing this technique as well. This is just a basic one where you just put it in like this. Usually the needle goes in about 1/2 inch. Depending on the issue and area, it could go deeper or more shallow. Sometimes you stimulate the needle by twisting it. Sometimes you thrust it up and down. You can change directions depending on whatever the issue is here. Then there's also freehand needling. It's when you just take the needle here without the tube, and you place the needle on the skin like this, go vertical, and then press it in here. This is a more advanced needling technique. Most practitioners don't do this one, but it's the most traditional style. And the needles contain a shaft and the handle, and then the needle and the point here, like this. And the needles are really small and fine needles. Usually about 15 needles can fit inside of a hypodermic needle. And they're very sharp, so it's usually a pain-free experience. Once the needles go in, you shouldn't feel any pain. You might feel pressure, tingling, wave-like sensation, floating sensation, that's all normal. Usually after about 10 or 15 minutes, you start to feel kind of relaxed and sleepy. Sometimes when needles are taken out, you might feel a little lightheaded due to the increase in circulation. But that also is normal. I've also had a few instances where people came in to get acupuncture for fertility, and after successful treatments, they had a baby, and then they brought the baby in to the clinic to say thank you. So that's always very rewarding and memorable as well. Last cup, it's a special kind of cup, and it causes a vacuum, and then you put that on the skin, and it causes suction. And the suction, in traditional Chinese medical theory, is believed to remove toxins and heat from the body. So it's used mostly if people have colds or flu. It also can be used in pain. Then there's different kind of needles that you can use for bleeding. And also in traditional Chinese medicine, a practitioner should know acupuncture and all the different modalities of that, as well as herbology, massage, qigong, and tai chi. The frequency of treatments and the treatment plan depends on the particular ailment and how long the person has had the problem and what are the contributing factors for the problem. So it's usually a case-by-case basis for how long the treatment plan will last. Usually with treatments, the main complaint that people have is pain. So they come in for pain, and then usually acupuncture is very effective at helping reduce or eliminate pain. Usually people have a minimum of a 20% reduction or more. I also see a lot of people for stress, anxiety, and emotional disorders, infertility and gynecological problems, and digestive problems are also very commonly treated with acupuncture. You might feel some pressure, tingling, a wave-like sensation, even floating, but it shouldn't be painful. Usually after about 10 or 15 minutes, you feel kind of relaxed and sleepy. So if that happens, just go to sleep, okay?
Okay.
Do you have any questions or anything?
Yeah, usually my skin is all sensitive, and it's gonna be itchy or something after that.
After the acupuncture?
Yeah.
It's possible that it could be itchy, but usually not. In the United States, to perform acupuncture, you have to use pre-sterilized, one-time use disposable needles. So you just use them once and then you dispose of them, and they're already clean before you receive them, and they're in a special sealed pack. There's different kinds of needles, different lengths and different thicknesses depending on what you're treating. So for example, if someone has a pain condition, you might use a larger needle. And if you do more stimulation on the needle, you might use a thicker needle as well. Then there's also a 7-star needle, which is a small hammer-like device with 7 little needles on the end, and you pound the muscle, and that helps to release the muscle. And if someone has more of a deficiency or weakness problem, then you would use smaller or thinner needles with less stimulation. And then there's also even smaller needles that you use for the ear. Then there's also press tack needles, which are small circular needles that you leave in the skin or the ear once the treatment is over. Usually the needles are made out of stainless steel, but they can also be made out of copper, silver, and gold. In traditional times, the needles might have been left in even longer, 1 to 5 hours. Sometimes they would even leave the needles in overnight. But in today's practice, usually the needles are left in for 30 minutes to an hour. People come in and they feel a certain way, and then when they leave, they usually feel better, so that's rewarding for me and to them. So in general, I do love what I do. I find that I like to do acupuncture the most because it has the possibility to treat the widest range of different problems that people have, and you can treat a lot of different things simultaneously, and the results are very fast and people feel better right away, so that's also rewarding. The frequency of treatments and the treatment plan depends on the particular ailment and how long the person has had the problem and what are the contributing factors for the problem. So it's usually a case-by-case basis for how long the treatment plan will last. Yeah, one of the most memorable treatments I did was I had a patient who was an old lady, maybe around 85 or 90 years old, and her niece was getting married the next day, but she had pain so bad that she couldn't walk. So I gave her acupuncture, and the next day she was able to walk, and she even danced at the wedding, so that was a great experience. In acupuncture, actually the word is mistranslated as acupuncture, but in Chinese the word is actually acupuncture and moxibustion. They're always together. So moxibustion is another form of treatment where you use heat therapy and you burn special kind of herbs over the points and the meridians of the channels. There's also cupping where you heat inside of a glass cup. It's a special kind of cup and it causes a vacuum, and then you put that on the skin and it causes suction. And the suction in traditional Chinese medical theory is believed to remove toxins and heat from the body. So it's used mostly if people have colds or flu. It also can be used in pain. Then there's different kind of needles that you can use for bleeding. And also in traditional Chinese medicine, a practitioner should know acupuncture and all the different modalities of that, as well as herbology, massage, qigong, and tai chi. All right, this is a moxa stick. This one's almost finished. Usually they're about as long as a cigar. And you light the end kind of like a cigar, and you wait till it gets red hot like a coal. And then you would take that and hold it over the point. You could hold it over one point, or you could trace the lines of the meridians. You can tap the point, it's called pecking. You can make circles around the point. There's different methods here. Actually, moxibustion predates acupuncture. And this is also pain-free, you just feel heat on the area. And after you heat the certain areas, you do different points in different areas of the body. It helps relieve pain. It can also help if someone has fatigue, digestive problems, things like that. And when you're finished, there's a special thing here that you put the moxa in to extinguish it. Usually you have to use a special kind of thing because it's such a red hot coal that it can be dangerous, so you have to use a special kind of tray to extinguish it, and this is a special one for moxa here. And this is the smokeless moxa. I use this because if you use the regular one, it can produce a lot of smoke, so usually it's kind of uncomfortable for people in the office. I have two offices. One of my offices is located at 1608 20th Street on the 3rd floor, and my other office is on 1900 Q Street on the 3rd floor, and these are both located in DuPont Circle.
Hi, I'm H. Frank Neely, licensed acupuncturist.